Women and alcohol. Ask about alcohol.ie. In Ireland, most of the messages we hear about alcohol are positive, relaxing, having fun with friends, or rewarding ourselves in some ways. We don't often talk about negatives, but the risks are real. If you drink and you have a high risk of developing health problems as a result of drinking in comparison to a man. Health problems can develop as a result of drinking alcohol are also less likely to start earlier in life, even if you drink the same amount as a man. This is because women's bodies absorb alcohol faster, contain less water so alcohol isn't diluted as much, contain more fat which absorbs alcohol slower than muscle, have fewer enzymes that can break down alcohol. Alcohol in your health. Alcohol and cancer. Alcohol is responsible for 1 in 8 breast cancers in Ireland and increases your risk of some other cancers such as mouth, throat and bowel. Just as smoking doesn't cause lung cancer overnight, alcohol does not result in cancer diagnosis immediately, but it does increase your cancer risk 10 to 20 years later. There's no safe level of alcohol when it comes to cancer, but the less you drink, the lower your risk of developing alcohol-related cancers. Any amount of any type of alcohol increases the risk of developing cancer. Alcohol and liver disease. Drinking more than the lower risk guidelines roughly doubles your risk of cirrhosis of the liver disease, and also increases your risk of liver cancer. Most heavy drinkers have a build-up of harmful fat and inflammation in their lives. Alcohol in your heart. Regular or high-risk drinking can increase your blood pressure and can lead to strokes, and may cause diseases of the heart, muscle, cardiomyopathy. Alcohol and mental health. Many people see alcohol as a way to relax and de-stress. However, alcohol can make it harder to cope with day-to-day stresses. At first, alcohol can seem to lessen symptoms of low mood anxiety, but continued drinking will cause these feelings to worsen and may increase your chances of becoming dependent on alcohol. Your tolerance increases the more you drink, so if you drink to cope, over time you need to drink more to get the same level of temporary relief. Drinking less is better for your mood and mental health. Alcohol and weight gain. We often don't think about calories in alcoholic drinks the way that we do with food, but a glass of wine or a pint of beer can contain the same amount of calories as a bar of chocolate. Also, we often crave fast food and healthy snacks when we have been drinking, and additional calories can add up very quickly. Alcohol and pregnancy. During pregnancy, alcohol passes from your bloodstream through the placenta into the baby's bloodstream. When it can affect your baby's development, explosive alcohol in the womb can affect the brain and the body of the developing fetus. Baby. It is best for your baby if you don't drink alcohol while you're pregnant or planning to get pregnant. When you drink alcohol, so does your unborn child. Alcohol and personal safety. Alcohol lowers inhibitions, makes us more impulsive and causes us to do things we may not do if we're sober. Being drunk increases our chances of being in an accident. It also increases our vulnerability to being exploited by others. Cope with someone else's drinking. If someone in your immediate family is a heavy drinker, it can leave you and your children unhappy, angry, scared, confused, guilty and unable to cope. If the person is violent towards you, talk to someone you trust and always consider your own and your children's safety. You can get help and support by contacting Women's Aid. It's a 24 helpline. Drinking guidelines. There is no safe or healthy amount of alcohol, but drinking with low risk guidelines can reduce your risk of harm. For healthy adults aged 18 to 65, the low risk guidelines are currently women 11 standard drinks or 110 grams of pure alcohol or less a week, men 17 standard drinks or 170 grams of pure alcohol a week. Which one standard drink of pure alcohol is like half a pint of beer, stout, ale, or single measure of spirits, or a glass of wine. Space and pace your drinking. Try to have at least 2 or 3 alcohol-free days a week, and spread your drinks over the week. Drinking more than 6 standard drinks at a time significantly increases the risk of your health and well-being. Spacing and pacing your drinks will also help you to avoid building tolerance to alcohol, forming a habit. But wine's okay, right? The rarity is that your body can't tell the difference between different types of alcohol, such as wine, beer, or spirits. It's how much alcohol you drink that matters, not what you drink. Tips to drink less. Try to keep within the low risk weekly limits. If drinking at home, use a drink measure to calculate how much you are pouring. Buy smaller glasses. A big wine glass can hold 2 standard drinks or more. Keep track of what you're drinking with a drinks diary. Note how much you drink and when and how you feel afterwards. Try alternative non-alcoholic drinks such as water. Don't get involved in rounds. This means you can drink at your own pace and stay more in control when you're out. Choose a lower strength drink whenever it is wine or beer. Do something else. Try a fun non-alcoholic based activity with friends. When it's not safe to drink at all, you are pregnant or considering becoming pregnant. You regularly lose control of your drinking, or you find that once you start drinking you cannot stop. You are experiencing some alcohol-related physical or mental health problems. You are under the age of 18. If you're unsure if it's safe to drink alcohol, check with your doctor or health care professional. This is a video of women and alcohol.